As the flu season takes off, you may be worried about getting sick. The number of hospitalizations from the flu this season have surpassed what's been seen the past 10 years. Experts have been warning of a tripledemic with the uptick in COVID, RSV, and flu cases. What is a flu vaccine? Influenza, flu, vaccines, often called flu shots, are vaccines that protect against the 4 influenza viruses that research indicates will be most common in coming weeks and months. Most flu vaccines are flu shots given with a needle, usually in the arm, but there also is a nasal spray flu vaccine. There are many flu vaccine options to choose from, but the most important thing is for all people 6 months and older to get a flu vaccine every year. If you have questions about which vaccine is best for you, talk to your doctor or other healthcare professional. More information on approved flu vaccines is available in CDC's table, U.S. influenza vaccine products for the 2022 to 2023 season. Experts say a flu shot is your best defense against the virus, but some people are opting to skip the vaccine, lamenting that they will get the infection anyway. So can you get the flu after receiving the shot? Flu shot reduces the severity. The flu vaccine usually reduces the risk of getting sick with the flu each year by between 40% and 60%, depending on the strain that circulates and how well the vaccine matches that strain. While the vaccine cannot guarantee you won't get sick, it helps protect against severe illness that can lead to hospitalization and death, similar to the COVID shot. Data found this year's flu shot reduces hospitalization risk by nearly 50%. Per the U.S. CDC. People with chronic conditions, like lung or heart disease, are at a higher risk of getting severely sick from the flu. So the vaccine is crucial in preventing hospitalization in this group. Flu vaccine prevents millions of illnesses and flu-related doctors' visits each year. During 2019 to 2020, the last flu season prior to the COVID-19 pandemic, flu vaccination prevented an estimated 7.5 million influenza illnesses. It also prevented 3.7 million influenza-associated medical visits, 105,000 influenza-associated hospitalizations, and 6,300 influenza-associated deaths. Is the flu shot effective? It takes 2 weeks for the body to generate an immune response after the jab. If you get the flu within that 2-week window post-vaccine, it's likely because your body hasn't guarded itself against the virus yet. Also, you may have already had the flu when you received the vaccine. Another virus with similar symptoms. Flu and COVID share a host of symptoms, including cough, sore throat, fever, chills, and more. If you have flu-like symptoms and you've been vaccinated, it may be a different virus. Testing will give a clear answer to the patients who assume they had either COVID or the flu based on their symptoms but seldom have proof. It's better to get tested instead of assuming a particular virus caused the symptoms. It can lead many to think they are immune from an infection they never had. There are a lot of these viruses. They mimic one another. Immune system matters. Those 65 and older, who make up the bulk of hospitalizations from the flu every year, don't have as strong an immune response to the flu vaccine as those younger. The CDC recommends other vaccines for this population, some being higher dose. For people receiving immunosuppressive therapy, like for cancer treatment, or for those who have an autoimmune disorder, immune response to the vaccine may also be less effective. If you're over 18, CDC recommends a different set of flu shot for this group. If the pharmacy doesn't have the particular flu vaccine you're looking for, get the general vaccine that's available. Any vaccine is better than no vaccine. Can flu shot give you flu? Some worry whether the flu vaccine can actually give you the flu itself. However, the vaccine is made from an inactivated or killed part of the virus, so it's not possible for the virus to replicate and cause illness. Your body may have side effects right after the shot like fever, soreness, headache, nausea, or muscle aches. It's a sign of the body creating an immune response. The side effects subside within a few days. As people gather indoors when it's cold, it's recommended to do your part and stay protected even if you're not high risk. WHO should and WHO shouldn't get flu shot? US CDC recommends everyone 6 months old and above in the United States should get an influenza, flu, vaccine every season with rare exception. CDC's Advisory Committee on Immunization Practices has made this universal recommendation since the 2010 to 2011 flu season. What are the side effects? Common side effects from a flu shot include soreness, redness, and/or swelling where the shot was given, headache, low-grade fever, nausea, muscle aches, and fatigue. The flu shot, like other injections, can occasionally cause fainting. Can severe problems occur? Life-threatening allergic reactions to flu shots are very rare. Signs of serious allergic reaction can include breathing problems, hoarseness or wheezing, hives, paleness, weakness, a fast heartbeat, or dizziness. In case of any severe complication, call a doctor or get to a doctor right away. The bottom line is, get vaccinated. Both COVID-19 and the flu may be spreading at the same time. Vaccination is the best way to protect against both.